For decades now, we've been using median sternotomy, that means chopping the sternum open, the chest bone open to access the heart. In the last 10 or 15 years or so, we transferred to smaller incisions on the side to carry out the same heart operations. And this new technology, this new platform has proven very safe and very efficient and is now conquering the surgical world. Well, absolutely. More and more technology is evolving and surgeons are becoming better at their skill, so they continue adopting minimally invasive heart surgery. So then the tools and equipment has been fashioned specifically for minimally invasive heart surgery, hence lowering the threshold both for the surgeon to carry out minimally invasive heart surgeries as well as for the patient to adopt it. So in our book, we have indeed two very strong differentiators. It's a book that comes alive. It's every after paragraph, we integrate at least one or more QR codes. So these COVID times now have taught us how to use our phone to scan the QR code. Now, by scanning the QR code after every paragraph in the book, it takes you to the video content on the internet. Basically, the reader is not just reading the book, is experiencing the book. And the link through the QR code takes him to the video where he can see how the actual procedure is done. That is critical for heart surgeons, trainees, perfusionists, nurses. The second differentiator, equally important, is the structure of the chapters. So the subtitle of our book is A Practical Guide. So the chapter is laid out in such a way that the reader can refer to resources where he can train, what instruments to use. We even publish our codex from the operation theater. Also, he will learn where to go, which workshops and conferences to visit. He will learn about alternative techniques, controversies, tips and pitfalls in the particular technique that is handled in that chapter. So it's a very, very rich book, adequate for our times, and it may form the foundation for more books to follow in the future.
Good day, everyone. My name is Mark Ruel. I'm a cardiac surgeon in Ottawa, Canada, and one of the authors of the Minimally Invasive Cardiac Surgery, A Practical Guide, book that was put together by the entire publishing team under the leadership of my friend and colleague, Theo Kofidis. I think you will find that the authors who are compiling this book are real authorities in the field of minimally invasive cardiac surgery. And I think all surgeons will find this book very useful in undertaking and succeeding in the highly challenging, but at the same time, very rewarding world of minimally invasive cardiac surgery. Happy reading.
The textbook, Minimally Invasive Cardiac Surgery, edited by Professor Theo Kofidis from Singapore, was written by expert surgeons from across the globe. It is, as the title says, a practical guide with a completely innovative chapter structure. You will find how I do it aspects as well as instructions on how and where to learn less invasive heart surgery. It is a really valuable tool for any practicing or learning heart surgeon.